Parencyma shows smooth oblique indentation on the posterior wall of the esophagus. What is most likely cause of these appearances? Apparent right subclavian artery. Okay? On the posterior wall of the esophagus indentation here, so it will be apparent right subclavian artery. And if an anterior wall, then apparent left pulmonary artery. The apparent left and right subclavian artery, left subclavian artery, and indentation in the anterior esophageal wall, and the indentation in the posterior esophageal wall, apparent right subclavian artery. Apparent right subclavian artery indentation of the posterior esophageal wall and barium shallow, apparent right subclavian artery. The enlarged left atrium compressing the esophagus. Okay. Question number 38. Women on oral contraceptive pills. Which additional radiology finding will favor diagnosis of hepatic adenoma rather than focal nodal hyperplasia, accompanying acute subcapsular hematoma? Adenoma has a tendency to hemorrhage. So, on oral contraceptive pills, which additional radiology finding would favor diagnosis of hepatic adenoma rather than focal nodal hyperplasia, accompanying acute subcapsular hematoma? Question number 39. Men with jaundice and malaise. Ultrasound shows general decrease in liver echogenicity and well distended gallbladder where wall thickness of 4 mm. Most likely diagnosed acute viral hepatitis. General decrease in liver echogenicity and well distended gallbladder with wall thickness of 4 mm. Diagnosed acute viral hepatitis. Question number 41. We do not tropical structure separate the right and left subphrenic spaces. Falciform ligament. We do not tropical structure separate the right and left subphrenic spaces. Falciform ligament. Question number 41. Too unwell to undergo an erect chest radiograph. What is the most appropriate alternative plan to detect the presence of a free intraperitoneal gas? Left lateral decubitus abdomen. The left lateral decubitus position of the abdomen to detect the presence of free intraperitoneal gas. So patient most appropriate alternative plan to detect presence of free intraperitoneal gas. Left lateral decubitus abdomen. Question 42. Ultrasound shows the extrahepatic common bile duct measured 5 mm diameter. What is the most appropriate for the investigation? MRCP. Okay, so this image shows that the MRCP, this is MRCP. The important thing is that MRCP, you will see all fluid, it's all MRI, and you will be able to see fluid-like lesions. So it's used to see subhepatic collections and bile leaks. So if the extrahepatic common bile duct measured 5 mm diameter, most appropriate imaging investigation, MRCP, to see the cause. Question number 43. The gastrointestinal artery normally has its origin from which vessel? Common hepatic. Gastrointestinal artery has its origin from common hepatic artery. Gastrointestinal artery has origin from common hepatic artery. Question 44. Suspected to be hepatocellular carcinoma. What would be the expected appearance of the lesion on T2 WMR images for improvement of superparamagnetic iron oxide particles? Lesion signal intensity is unchanged. Rest of liver decreased signal intensity in hepatic cellular carcinoma. Because iron oxide negative MR contrast and uptake by Kupffer cells which is not present in tumors and liver, so decreased signal. Patient has suspected hepatocellular carcinoma, so MR findings on T2 will be for after improvement of superparamagnetic iron oxide particles. The hepatocellular carcinoma lesion intensity will be unchanged, and rest of the liver should show decreased signal intensity because the carcinoma cannot take up MR contrast because it has no Kupffer cells. So it has unchanged signal intensity of the cancer, carcinoma, and rest of the liver shows decreased signal intensity. Question number 45. Woman on oral contraceptive pill. Ultrasound shows splenomegaly and ascites. The hepatic veins are not visualized on Doppler ultrasound. What is the most likely diagnosis? Acute Buchiari syndrome. Woman on oral contraceptive pill ultrasound, splenomegaly and ascites. Hepatic veins are not visualized on Doppler ultrasound scan. Most likely diagnosis: acute Buchiari syndrome. Question number 46. Abdominal radiography, liver and spleen are noted to be on increased density with stipple appearance, most likely cause thoracotrastosis. The hint is stipple appearance. Stipple appearance is seen in thoracotrastosis. The stipple appearance of the liver and spleen is seen as thoracosis. Question 47. Ultrasound shows three small rounded echogenic structures in relation to the anterior wall of the gallbladder. Gallbladder polyp. Ultrasound shows three small rounded echogenic structures in relation to the anterior wall of the gallbladder. There is no posterior acoustic shattering. Appearances remain constant with variation in appearance position. Most likely diagnosed cholesterol polyps. Constant change of position and with change of position and rounded. Correspond to three small rounded echogenic structures in relation to the wall of anterior wall gallbladder, and there is no posterior acoustic shattering. And appearances remain constant with patient change position. Diagnosis: cholesterol polyp or gallbladder polyp. Question 48. Man with alcoholic cirrhosis plus jaundice. CT scan to encapsulate 20 mm focal area of low density in the liver, which demonstrates arterial phase enhancement and rapid washout and delayed imaging. Most likely diagnosed hepatocellular carcinoma. Rapid washout and delayed imaging is seen in hepatocellular carcinoma. So man with alcohol and cirrhosis plus jaundice, and then there's a focal area of low density in the liver, which shows washout and delayed imaging. Diagnosed hepatocellular carcinoma. Rapid washout. 49. Man with ulcerative colitis. CT scan shows multiple areas of dilatation and stenosis of shortest intrahepatic biliary ducts with wall thickening and contrast enhancement of the extrahepatic biliary ducts. Most likely diagnosed primary sclerosing cholangitis. A man with ulcerative colitis. CT scan shows multiple areas of dilatation and stenosis of intrahepatic bile ducts or tortuous and shows multiple areas of dilatation and stenosis with wall thickening and contrast enhancement of the extrahepatic biliary ducts. Most likely diagnosis primary sclerosing cholangitis. 50. Which feature of favor diagnosis of colorectal carcinoma rather than diverticulitis? Mucosal ulceration. And which in colorectal carcinoma rather than diverticulitis there will be mucosal ulceration. Question number 51. Barium swallow shows multiple flask-like outpouring. Barium swallow shows multiple flask-like outpouring of the barium ion in longitudinal rows parallel to the long axis of the esophagus. The following coming associated condition: diabetes. What is diagnosis? Esophageal pseudo-diverticulosis. Barium swallow shows multiple flask-shaped outpouring of the barium arranged in longitudinal rows parallel to the long axis of the esophagus. It is associated with diabetes and diagnosis esophageal pseudo-diverticulosis. Question number 52. What is the most common cause of varices affecting the upper third of the esophagus? Superior vena cava obstruction. Most common cause of varices affecting the upper third of the esophagus is superior vena cava obstruction. Varices are tortoise vein defect in upper esophagus. Okay. Tortoise vein defect in upper esophagus is and another is the downhill variant of superior vena cava obstruction. There are two variants of varices, esophageal varices: uphill and downhill. Question number 53. Known large paraesophageal hiatus hernia. Abdominal radiograph shows mildly distended stomach in the left upper quadrant extending into the chest. Most likely diagnosed as acute gastric volvulus. Abdominal radiograph shows mildly distended stomach in the left upper quadrant extending to the chest. Diagnosed acute gastric volvulus. Abdominal radiograph shows mildly distended stomach in the left upper quadrant extending to the chest. Diagnosis: acute gastric volvulus. Question number 54. Which of the following may improve the detection of macula diverticum on technetium and upper technetium study? Pure administration of cimetidine may improve the detection of the macula diverticum or pertechnetic study. Pure administration of cimetidine. Question number 55. Weight loss and diarrhea. CT scan shows multiple enlarged low attenuated mesenteric lymph nodes containing fat fluid level and sphenic atrophy. Most likely diagnosed celiac disease. Weight loss and diarrhea. CT scan multiple enlarged low level attenuating mesenteric lymph nodes containing fat fluid level and sphenic atrophy. Diagnosis: celiac disease. Question number 56. Which imaging feature would favor diagnosis of fibrolaminar carcinoma of the liver rather than focal nodal hyperplasia? Calcification in scar. This focal nodal hyperplasia, fibrolaminar carcinoma. Focal nodal hyperplasia shows enhancing central scar on delayed phase. Enhanced central scar in delayed phase is seen in focal nodal hyperplasia. In fibrolaminar carcinoma, there's calcification in the scar. Small calcification in the scar is seen in fibrolaminar carcinoma. Calcification in the scar is seen in fibrolaminar carcinoma. No enhancement of central scar on delayed phase. In focal nodal hyperplasia, on delayed phase there is enhancing central scar. Question number 57. Patient with cystic fibrosis, which gastrointestinal pathology may occur as a result of high-dose lipase supplementation, fibrosis, colonopathy. In cystic fibrosis, which gastrointestinal pathology occurring as a result of high-dose lipase supplementation, fibrosis, colonopathy. Question number 58. Ultrasound 2 days following atrophic liver transplantation which demonstrates periportal edema and small fluid collection at the high level of the liver. What is the most likely diagnosis? Normal post-transplantation findings. Ultrasound 2 days following liver transplant, periportal edema and small fluid collection at the high level of the liver. Diagnosis: normal post-transplantation findings. Question 59. A transjugular intrahepatic portal systemic shunt lies between the portal vein and which vessel? Hepatic vein. A transjugular intrahepatic portal systemic shunt lies between portal vein, and hepatic vein. Tips: shunt lies between portal vein and hepatic vein. Question number 60. Which people are on CT for the diagnosis of xanthogranulomatosis cholecystitis rather than gallbladder carcinoma? Intramural hypertonating nodules throughout the gallbladder. They're air bubbles. Now, xanthogranulomatosis cholecystitis and GB carcinoma. Okay. See, what's important is memorize this that which feature on CT favor diagnosis of xanthogranulomatosis cholecystitis rather than gallbladder carcinoma. Intramural hypertonating nodules throughout the gallbladder. Question 61. Regurgitation of undigested food. Barium swallows with barium filled out pouch extending from posterior esophageal wall and level Q5 C6. The esophageal web, the zengal diverticulum, the esophageal webs, the zengal diverticulum, and zengal diverticulum. Esophageal web, zengal diverticulum. Now, regurgitation of undigested food. Barium swallows with barium filled pouch extending from the posterior esophageal wall at the level of the C5 to 6 that is causing esophageal compression. What is most likely diagnosed? Zengal diverticulum.